You know that feeling when it's summer and you don't have any responsibilities and tan skin? You come inside after a long day spent outside, look in the mirror, you have red cheeks and a freckled nose, and you're just so happy. Wouldn't you want to feel like that every day, including during the winter months? Well, you can. So today I would like to talk to you about the risks and benefits of tanning beds and alternative methods to tan. So I want to start out with the pros of tanning in a bed. Now you may be asking yourself, how are there pros to tanning in a bed when all we ever talk about is skin cancer? Like, how? So believe it or not, according to artisantan.com, um, compared to outdoor sun exposure, tanning beds can actually prevent skin cancer because number one, you're spending less time in the bed, and less time equals less exposure. Tanning beds also help you lose weight, which because it boosts your metabolism and it kicks your thyroid gland into overdrive, which puts you in caloric deficit, which makes you burn more calories. Tanning also affects your mood by giving you that daily dose of vitamin D, which can treat depression and anxiety, and also reduces what we have in Oregon, this little seasonal affective disorder because we don't see the sun. Since it gives you that vitamin D, it helps you not be so depressed during the winter months, and which balances your hormones. And tanning improves your overall confidence by reducing your stretch marks, acne, scars, and several skin issues, including psoriasis, eczema, and other things. So most of these risks come from abuse and over. So although there are a lot of good things about tanning beds, there is unfortunately a downside. So most of these risks come from abuse and overuse of the bed. However, some risks are just inevitable, and you should know going into it. So obviously, tanning leads to aging, which we see on skincancer.org and medicinenet.com. But worldwide, there are more skin cancer cases due to indoor tanning than there are lung cancer cases due to smoking. One study observing 63 women diagnosed with melanoma before age 30 found that 61 of them, that's 97%, use tanning beds. So when your skin cells are damaged from the UV rays, they will produce more melanin, which makes your skin darker and gives you that better tan, but you may get skin cancer. So in addition to tanning beds, there are also several methods to getting that bronzed look without the risk, as well as multiple methods to producing the same benefits as tanning beds. So obviously we have sunless tan, which is spray tanning, mousse, foam, and tanning water, which gives you the same color. On skincancer.org, it does list a couple other options to reaping the same benefits, including exercise, which will improve your mood and can help you lose weight. On webmd.com, we see that red light helps erase some of the damage done by UV rays and can help with your aging and scarring and just blurring some of those, insecurities that some people may have. So in conclusion, it's always nice to know the pros and cons of something like tanning so you know what you're getting yourself into before you actually do it. Here are some final thoughts I would like to share with you. So number one, if you stick to the rules of tanning, so only going in once per day, using eye protection, etc., the benefits could outweigh the risks for you. And number two, you could be putting yourself at risk for skin cancer and premature aging, so just know that getting into it. And number three, finally, there are several ways to reap the benefits of tanning without actually completing the process. So spray tanning, red light, exercise, we talked about these. So you know what's best for you. And if you're interested in the process of tanning in a bed, but you have concerns, consult a doctor before use. Thank you for taking the time today to listen to my talk about all things tanning.